My name is Kristen Bourgeois-Tebby, and I'm a nurse on the Rehab and Skilled units at Mercy Medical Center, Dubuque. Thank you for watching this short video about the importance of oral care. You may be wondering why I've chosen to focus on the topic of oral care. Let me set the scene for you. As professional caregivers, we would never let a patient sit in a wet incontinence brief overnight, would we? Why not? We insist on changing wet briefs promptly because we know that in addition to hurting a patient's dignity, sitting in a wet brief can cause skin breakdown, pain, and can lead to urinary tract infections. Now let's think about oral care. Poor oral care can lead to dry mouth, mouth pain, mouth sores, and cavities. These conditions can get in the way of effective communication, patient comfort, and proper nutrition, extending a patient's recovery time. But these are not the biggest risks of neglected oral care. Did you know that poor oral hygiene can also increase the risk of hospital-acquired pneumonia? In this short video, I will show you why hospital-acquired pneumonia is so dangerous, why our patients are at risk, and how you can protect them by encouraging and providing good oral care. Non-ventilator associated hospital-acquired pneumonia is more common than all three of the device-associated infections listed here. It has a mortality rate similar to ventilator-associated pneumonia, but its incidence is much higher, which means that more people actually die from non-ventilator associated pneumonia. Why are our patients at risk? There are three key factors. First, changes in oral microbes. Studies show that within 48 hours of hospital admission, patients have changes in their oral bacteria, including the growth of more infectious germs. The second risk factor is microaspiration, or breathing in tiny drops of liquid that normally would not cause disease. Even healthy adults microaspirate while they sleep, but aspirating germs that their bodies are not used to can lead patients to develop pneumonia. The last risk factor is a weakened host. Just being in the hospital can weaken a patient's immune system and disrupt their daily routines. They may lack the energy or desire to perform good oral care and may not do it unless we encourage them or assist them to do so. So, how can we protect our patients from hospital-acquired pneumonia? In addition to other basic nursing care measures, we must provide effective oral care. Reducing oral microbes through good oral hygiene is crucial in preventing hospital-acquired pneumonia. Researchers in one study found that in 73% of cases, no oral care was documented in the 24 hours before diagnosis of non-ventilator associated hospital-acquired pneumonia. So, what exactly should we do? We should offer oral care to every patient every morning and every night. Some patients may have orders for more frequent oral care, but twice daily should be our basic standard of care. For patients with teeth, offer to let them brush their teeth with a toothbrush and toothpaste. Optionally, these things can be set up at the bedside with an emesis basin and a cup for water. For patients with dentures, their dentures should be placed in a denture cup overnight with a cleansing tablet, unless the patient chooses to brush them instead with a toothbrush and toothpaste. Also offer to let the patient rinse their mouth with mouthwash or brush their gums with a toothbrush and toothpaste. If the patient is unable to perform oral care himself, we should provide total assistance. In addition to providing oral care, we should also document all oral care and all refusals in iView under Personal Care, as shown on this screen. Charting the care allows us to track our progress and can also be used to show we did all we could to prevent hospital-acquired pneumonia. MDS and rehab FEM nurses also need this documentation to show Medicare how much help each patient needs, which determines our level of reimbursement. The view shown here is the nurse's view, but the CNA view is very similar. What if patients refuse oral care? Let's go back to the example of a wet incontinence brief. Patients have a right to refuse care, but we also must advocate for them. If a patient refused to let you change a wet brief, what would you do? Most of us would explain why this care is necessary and what could happen if we didn't do it. This same type of education can help patients understand why oral care is important. Don't be afraid to tell a patient that skipping oral care can increase their risk of getting pneumonia while in the hospital. The patient is very tired. Some patients refuse oral care because they are tired out from a long day of therapy. If we help them into bed first, then offer to set them up with their supplies, they may be more willing to perform oral care. Sometimes patients don't want to be a bother. They may feel bad that they need help with basic cares, and they want to bother us as little as possible. For these patients, how we approach the question is very important. Instead of saying, "Do you need to brush your teeth?" which may lead the patient to think, "Well, I don't really need to," try saying, "Would you like to brush your teeth?" Or instead of asking, "Do you want to just do your teeth in the morning?" which some people will agree to just because we suggested it, try saying, "How about brushing your teeth before you go to sleep?" And remember, follow up any refusal with at least one statement of advocacy or education. If we as caregivers follow these suggestions and provide good oral care, we can significantly reduce the incidence of hospital-acquired pneumonia for our patients. One nurse-led oral care initiative at a hospital in Sacramento reduced the incidence of non-ventilator associated hospital-acquired pneumonia by 60%. In conclusion, oral care is not just for comfort. It is an essential, life-saving measure. Oral care should be offered to each patient every morning and every night, or more frequently if ordered. Any objections should be addressed with advocacy and education. Patients may still refuse, but not before hearing at least one statement of why this care is important for them. And all oral care and any refusals should be documented in iView. Thank you for watching this educational video. I look forward to seeing how our rates of oral care continue to improve as we strive to provide the best care possible for our patients.